Well, thank you, everybody. My name is Matt Diller. I'll be presenting on the representation of ownership and access to material needs, although I would think it'd be better to word that as access to goods in OWL 2. So as many of you probably already know, there have been a lot of efforts to study social determinants of health, using a lot of informatics tools and approaches. Or that incorporate a lot of informatics tools and approaches. So for example, there's the NIH Healthy People 2030, which lists a bunch of objectives and strategies for addressing social determinants of health and disparities. The CDC also has a number of programs that address social determinants of health. One example being the Childhood Lead Poisoning Prevention Program. There's also the NIH All of Us study. There's the Patient-Centered Outcome Research Network. There's the ARC Gravity Project and Siren, which I believe the Gravity Project is part of Siren. Previously, there was the World Health Organization's Commission on Social Determinants of Health, but that ended in 2008. And then more recently, they've had the Special Initiative for Action on Social Determinants of Health for advancing health equity. So there's a number of challenges related to this topic that I believe that ontology developers can play a major role in. So one of those is a lack of interoperability between health information systems. For example, one of the stated objectives of Healthy People 2030 is to increase the proportion of hospitals that exchange and use outside electronic health information. In addition to this, there's a lack of integration of EHR data with external environmental and social data. For example, a lot of data on mobile health, social care, and social risks, such as lack of transportation or housing, are often missing from EHR data and could be used by clinicians and social workers who work at hospitals. And then lastly, there's an ongoing effort to collect more SDOH in health information systems and integrate it with EHR data. Examples of this include the Prepare screening tool and Epic's Healthy Planet SDOH tool. Sorry, so let's get into goods and services, or more specifically, just goods. As many of you are aware, poverty is a major issue both in the United States and globally. In the United States alone, more than 1 out of every 10 persons lives in poverty, and that is actually growing, or has been growing. Whereas globally, around 8.6% of people live in poverty, and that's kind of been declining a little bit. As many of you are probably aware, this economic stability that's caused by poverty has a tremendous effect on one's ability to access goods and services. For example, access to healthcare can be determined by one's ability to pay for healthcare services, health insurance, and medication. And so a lot of scientists and researchers have come up with these so-called economic determinants of health that look at income, wealth, income inequality, and education status as possible risks or indicators of somebody's ability or inability to access goods and services. So what are goods? So Barry Smith has a really good, very brief video on YouTube on the ontology of social services. And he has a couple of informal definitions that he presents in there on goods and services. So for goods, he defines them as independent continuants, which can be alienated, such as cars, houses, bottles of milk. These are things that can be sold, gifted, and rented, or transferred between people. So I'm not going to dissect this definition too much here because it did seem to be a rather informal one and not something that something that was still in development. But one thing I want to know, I'm not sure all goods are independent continuants. I do think that all goods are probably continuants, though. And an example of a good that would not be an independent continuant is health insurance. Another example might be a data set, or a story or a song. But the main points that I want to kind of address here are goods are entities that through which their consumption is meant to produce a desired outcome, and are things that are transferable. Some of this was already mentioned in his definition. He also has a definition for services. I'm not going to get into that too much because this presentation is not focused on services really at all. And I think Barry's also going to be presenting on that later. So for types of goods, there's 4 different types that have been defined by economists. So just getting into these briefly, I have no interest, for clarification, I'm not really interested in ontologically defining what a good is and what these different types of goods are. I do think though that understanding these 4 different types kind of will inform how we could understand and formalize an individual's access to a specific good. And so the first type is a private good. These are goods for which ownership belongs to a single party, and for which their consumption by one person excludes others from consuming them. So examples being food and medication. Then there are public goods. These are goods that are open to access to the public, and for which their consumption by one party does not exclude other parties from consuming them. Examples of this would be streetlights, clean air, parks. Third, there are common goods. So these are goods that are open for access to the public, but for which their consumption by one party does or can exclude other parties from consuming them. So a community grocery store has a certain physical capacity that it can hold, and once it reaches that capacity, people really can't enter it to go shopping. Public electricity grid is another example. And then lastly, there are club goods. These are goods with exclusionary access to the public and for which their consumption by one party does not exclude other parties from consuming them. Example being health insurance or gym membership. So tying these back into social determinants of health. Let me actually go back one. So for public and common goods, as I mentioned here, theoretically, they are open for access to the public. In reality, however, it's not exactly the case that just because something is open for access to the public it doesn't mean that it's accessible to everybody in the public. And so there are a lot of factors that limit access to public and common goods. Most of them, from what I've seen, seem to be structural or individual in origin. And so, for example, a disability impeding one's mobility can prevent them from accessing facilities without adequate accommodations. Adequate accommodations being like long ramps for wheelchair access that have flat subsections so that people can, rest and not have to struggle the entire way up as they're going up the ramp. And so just examples of how this might impede somebody's access in the context of food access. So a person who has a low income, is disabled, and lives near a grocery store without adequate accommodations for their needs essentially lives in a food desert, even though our definitions of food desert don't account for that. Second, there's also a second example would be a person who is immunocompromised during a pandemic and lives near a grocery store without delivery or curbside access. They also would have their access to food hindered. And as I mentioned, so I have not been able to find a single method for defining or identifying food deserts that takes any of this into account. I've also asked around and have had no luck in finding this either. So just examples of some accessibility features that have been implemented but offer poor accessibility are these pathways and ramps. These are actually photos I took at the UF campus near our student union. So it's not obvious, but these are inclines, so they go up. They go up for a very long distance, and if you're in a wheelchair, this is actually something that you would struggle to use in order to access the student union or get to one of the main plazas that's a major center for traffic. So this red line kind of indicates in this photo exactly where the flat ground or where the ground levels off and where somebody would actually have flat ground to move on, just to give you a perspective of how much of a distance they would have to travel uphill. And these are technically ADA compliant. So the ADA does not actually have any stipulations on the length of a ramp. They just have stipulations on whether they have handrails and the degree of incline that they're at. So as I mentioned, existing definitions for food deserts do not capture this. one example of one of those definitions is the USDA's. So they say that a census tract qualifies as a food desert if it meets one of the following thresholds. It has a poverty rate of 20% or greater, or a median family income at or below 80% of the statewide or metropolitan area median family income, or it has at least 500 persons and or at least 33% of the population lives more than 1 mile from a supermarket or large grocery store. So the two factors they take into account are distance, travel to the grocery store, and your income, and that's it. There have been others who have identified the shortcomings of this approach, and so they have taken to coming up with novel ways of measuring and identifying food deserts. One study looked at travel mode, like walking, biking, or driving, distance, cost of food, like the average cost of food at the grocery store, access to transportation, whether or not a person had a car, and income. But again, they did not look at whether this was accessible to somebody who was disabled. So to make matters a little bit more complicated, the data on building accessibility that currently exists is pretty sparse. So in the United States, as far as I'm aware, there are no national level data sets on this. There are some data sets at the county and city level. For example, the city of Bloomington's 2018 sidewalks, curbs, and accessible curb ramps condition assessment data set. And then at the state level, a few states actually require that Medicaid contracted healthcare providers have their buildings analyzed and assessed for accessibility, but they again, this is only talking about medical facilities, and at that it's Medicaid contracted medical facilities. So this is just limited to those types of entities, and not anything broader like that people actually rely on for and can impact their healthcare. In addition to that, there are data sets on paved pathways such as sidewalks and roads, but there's not like universal coverage of every city, and some of those data sets that are in existence for some cities are incomplete. That being said, these data do exist, and there is a growing interest in collecting more complete and better quality data moving forward. So, for example, CMS has suggested that annual wellness visits, which are funded by Medicaid and I believe Medicare, offer promising opportunities to collect data on patient needs. And as well, there are tools, as I mentioned earlier, that integrate with the EHR or medical records that can be used by clinicians and social workers to collect information on social determinants of health. There's also a research group at Vanderbilt University. They've created a mapping access toolkit, which is a methodology for actually mapping out the accessibility of buildings within your area. And they've actually done this with they've mapped this accessibility out at the Vanderbilt University. So here's an example of one of the questions from one of the screening tools I mentioned. So this is the Prepare screening tool. I think this one's interesting because it kind of gets at accessibility of grocery stores for people with disabilities, but it doesn't explicitly ask about that. So this first question asks, in the past year, have you or any family members you live with been unable to get any of the following when it was really needed? Check all that apply. And the first example is food, and that's a yes or a no question. It doesn't ask about, it doesn't differentiate between finances, the accessibility of the building, your ability to even, get yourself there, et cetera, et cetera. It just asks whether or not you were able to get those things. The second question here is, has lack of transportation kept you from medical appointments, meetings, work, or from getting things needed for daily living? So this kind of can get at whether you have difficulty acquiring those things, but it doesn't specifically ask these questions. And so these types, the data that's produced by these questionnaires, it can't really be used to answer any sort of question related to accessibility to food. Okay, so moving on to my next so to the next set of factors. So for what I talked about earlier was for public and common goods. When it comes to private and club goods, these are things that are typically influenced by individual factors or as well as social factors. Forgot to list that there. But these include income, wealth, education level, which is tied to income and wealth, and employment, which is also tied to income and wealth. There are also population and regional factors like regional income inequality that could actually lead to tiered system of services and goods that are offered to the population there based on income. And so basically what access to private and public or private and club goods is often limited by our money and contract and whether or not somebody has a right or a has entered into some sort of contract to use some sort of facility or service, or good for that matter. So with money, access to goods is basically determined by how much money you could pay to spend on that good. That one's pretty simple. For contractual obligations, access to these goods are determined by whether you have entered into a contract with another party. So for example, health insurance, the contract you entered into with your insurance company stipulates whether they pay for that, your medical care, your medications, etc. Any type of devices you might need for your health. And then similarly with the gym membership, you have a contract with the gym that gives you access to their facilities and equipment. So here I've listed very non-comprehensive set of goods just to kind of create a discussion about how to start representing access to some of these goods. Be curious if anybody else is working with different types of goods that in a way that kind of intersects with what I'm doing here. So the ones that I have listed here are housing, which is a private good, health insurance, which is a club good, clothing and food, which are both private goods, and community grocery store, which is a common good, neighborhood sidewalks, also a common good. There are a variety of factors that influence one's access to these. So income, wealth, employment, as well as I mentioned earlier, living near a grocery store that's accessible via a sidewalk or living near a grocery store with delivery or curbside pickup. You have a question?
I do, and I don't need to take your question. Go if you want to take your question.
No, it's fine. That's fine.
So, I'm wondering what made food a private good versus a community grocery store common good. Like, how are you differentiating the two?
Yeah. So, I mean, when I go out and buy food, once I make that purchase, that food belongs to me. Only if I eat it, right, nobody else in the community would be able to also eat that food once I've actually, eaten and digested it. Whereas for a community grocery store, access to that is open to everybody, theoretically. And everybody could go to the grocery store to get their food. And if you do use it, it generally because, like I said earlier, because grocery stores have a limited capacity to the number of people that could occupy them at one time, there is a certain sense in which there is rivalry in terms of using that good, or not. Rivalry in terms of using that good. This is I guess this kind of falls into what economists, how they divide these types of goods.
Growing your own food, you need to access to a place to get the good, and somebody should be. Food is a complicated part, which is I think very valid, but it's also complicated because you need, again, unless you're growing your own food, you got to get it from somewhere, and somebody should be growing it for you. So it has lots of levels.
Yeah. So this is I mean, there are probably some drawbacks to the framework that they have for dividing these goods into different things. For example, like data as a good, there's certainly a lot of really bad data out there, or just nonsense data out there that is not really usable or offers any benefit to anybody. Like the spam emails you get probably probably are not the data within them are not a good. I would argue, but yeah. I'm sorry. Oh, cool.
Bart and John. You see them? That's right. Bart and John.
Hold on. Oh, okay. Yeah, go ahead. So the first one was who? Bart? Bart? Yeah, go ahead, Bart.
Hi there, thanks. Can you hear me?
Yep.
Great. Yeah, I just wanted to mention that at the University of Toronto, at the Center for Social Service Engineering, we're actually doing a lot of this kind of work that you're describing. And we do capture these kinds of services that you define here as goods. So I'd be really interested in connecting. One thing I'll mention about the sort of food desert that you're describing. So we look at it as a service gap where we essentially have a catchment area that defines a geographical location and a set of demographics or client characteristics. And we look at how that catchment area is serviced by a particular service category. So housing, health insurance, and so on. So yeah, I'm going to put a link into the chat just to kind of give you an idea of the kinds of things that we're working on. Now, we're looking at it from the perspective of measuring impact to see how impactful services are to the clients that they're servicing. So we're very much focused on the interaction between a client's needs and the services that actually are provided to satisfy those needs. But it very much sort of like what you're saying very much resonates with me and the kind of work that we're doing.
Very cool. Very cool. Awesome. I'm glad to hear that. And then there was one other question by John.
Yeah, I don't think this was covered in a previous question, but I'm curious about your identification with of health insurance with a good rather than a service, because it seems to me that health insurance would be a service. It's really sort of like a banking arrangement, and it's not really relevant in terms of access. I mean, you can just describe it as being one of the important services that people need access to. But just curious about why. Yeah, go ahead.
So I think health insurance. So I guess I probably should have been more specific. If you enter into an insurance policy, or if you purchase an insurance policy, I think it probably could be argued that that policy is a good, and then it gives you access to services. So there's a very complicated kind of relationship between these goods and services, in which some goods give you access to services. That's kind of my understanding of this. I'm open to being corrected on that.
Okay, that's
Does that answer your question?
yeah, thanks.
Okay.
It's not like a book. A printed book is a good, or I can sell it, loan it. You can't loan my health insurance.
Right.
Transfer ownership of my health insurance. It's not.
Right.
You want to call it a good one.
Yeah, there's yeah, that's an interesting point. Yeah, I'll have to take another look at that then. Any other questions?
I'm interested if you could maybe be more specific about the infrastructure aspect with neighborhood sidewalks as because that's in terms of access to food.
Yeah, oh, I'm sorry. Yeah, so if you're somebody who uses a wheelchair to get around, you're largely going to rely on sidewalks to get you from point A to point B. If your neighborhood grocery store doesn't have a sidewalk that leads to it, then you're either going to have to take a bike lane or either find alternative transportation to get there. Taking a bike lane in the United States is not always the safest because of the way that a lot of our roads and bike lanes create conflict between cyclists and drivers. But and I've actually seen people in wheelchairs using bike lanes right directly next to traffic, and it kind of it's it sucks to see that they have to use that. You can't really go through grass, to my knowledge, in a wheelchair, and there are pretty significant portions of cities in the United States, even in Gainesville, where there's a lot of bike lanes, there's a significant absence of sidewalks that prevents people with movement impairments from being able to get around. So yeah, that's the relationship. I should have clarified that a little bit earlier. I'm actually going to get into that a little bit on these next few slides here.
Quick, another question.
Yeah.
On the chat.
Oh, Lauren?
Hi, I had a question about how you have housing as a private good. So, I mean, I'm sure you know, just talking about like folks with disabilities, like, and poverty and income inequality and all of that, like, and maybe you've considered this, housing as a private good, I think has a pretty narrow, probably like to be a private good would probably have to be a pretty narrow definition of housing. Because
yeah,
I'm
sorry, go ahead.
Go ahead.
I think you're correct there. I think there are definitely ways in which like perhaps like a co-op or something in which housing is not so much a private good.
Yeah. Well, my first thought was like homeless shelters,
yeah, homeless
care
shelters as well.
homes for elderly people, you know, that they might have a private room. But there's also the fact that everything there is shared, and it depending on the place, it might not even be that private. So yeah, I mean, I know this is a complicated domain, so just wanted to bring up that idea.
Yeah. And then okay, so we have two more questions or two more hands raised. Bart, go ahead.
Yeah, thanks. Just on that note about kind of the difference between services and goods. So we make a distinction between services and need satisfiers, where services is sort of the activity of providing services or being available to provide certain services or providing certain goods, and then the goods themselves are the need satisfiers. So they're linked directly to clients' needs, but they're also really the resources. So, for example, having a private room would be a resource, and the shelter is actually providing the service of giving access to that, or scheduling or being able to book a particular room for a particular night and so on. So we make that distinction there.
Okay, cool. There was one other hand raised, I think. Maybe not. All right. If there are no other questions, or comments, I'm gonna go to the next slide. Also, how am I doing on time?
You're playing.
Cool. Okay, so now I'm going to get into some ideas that I've had for how to represent access to goods, or some of the goods that we've mentioned. And so we're gonna keep going with this food access example. So there are a number of relevant goods that we've discussed so far. Food obviously being the most apparent one, or the most central one to this. And then of course there are the sources for food within your community, like a grocery store, farmer's market, community garden. And fortunately, with the Obo Foundry community, there are a lot of classes already in existence and in production that represent some of these things. So the food ontology has food material, which they define as any substance that can be consumed by an organism to satisfy nutritional or otherwise, or other health needs, or to provide a social or organoleptic food experience. There's food shop, which is a parent class for a number of different types of food shops. So they define as a shop in which a business offers food products for sale or trade. One of their subclasses is grocery store, which is a food shop in which food products are the primary offer for a sale or trade. And then there are allotment gardens or community gardens. This is not defined in ENVO, but the class is there. And then unfortunately, the only class I could not find that fell into this list just for this exercise was farmers market, although I'm not sure. I think they only have limited use in trying to alleviate the food access limitations that people living in food deserts are faced with. But in general, there's pretty good representation, at least for these types of things. When it comes to infrastructure, there's also a good representation of this in the environment ontology. So they have constructed pavement, sidewalk, bike path, and road. I'm not going to sit here and read the definitions for you. I'm sure most people can look these up. I'm not also interested in dissecting any of these definitions. From what I could tell, they seem to be pretty good. That's fair.
Consider compressed air.
Yeah. Fair enough. And then lastly, there are building accessibility features like ramps with handrails, etc. And unfortunately, there is nothing in any ontology that I could really find that really correlates with or represents any of these things. The closest I could find was the nursing care and coordination ontologies class, which they label ramp. That class is undefined. I'm not entirely sure if it's meant to be like a ramp for like a clinical context, similar to how SNOMED CT's ramp concept is actually specifically meant for a clinical context. But for all of the other accessibility features that I looked for, there weren't any classes to represent any things like any of the other ones. For even just accessibility features or accessibility construction features in general. So this is an area of work that probably should be addressed if we actually want to be able to provide some sort of structured data to kind of map out and for use cases related to food access. So now I'm going to go into how to, or one possible approach to representing this stuff ontologically. So one of the first things I kind of played around with was whether access to some good could be represented as an ontology, as a single ontology class. And I've kind of gone away from that idea. Just because of the complexity of access. I do think, however, we can represent the reality side of someone's environment in an ontology, and that can be used to identify whether or not they have access or inaccess to food. And so this is an example. I'm using Gainesville, which is where we're from, as in the example here. And so each of these blocks are supposed to represent OWL individuals. And so you have a human, and you can assert that human is a member of the Porters community, which is a neighborhood within Gainesville. Porters community being an instance of the population and community ontology's ecological community class. This Porters community is located in the geographical region of the southeastern Gainesville, which is itself an instance of geographical region. It is also the location of a Winn-Dixie grocery store, which is an instance of grocery store. And that Winn-Dixie grocery store is adjacent to a sidewalk. I'm not sure adjacent to is the best relation here, but it's there, and it seems to work, at least for this demonstration. So I'm using it for that. And of course, sidewalk would be an instance of Envo's sidewalk. Now, another thing I actually played around with was certain types of object property assertions. So for example, you could theoretically say that the Winn-Dixie grocery store is adjacent to only a parking lot, to say that it is not adjacent to a sidewalk. But this is not ideal because, well, it prevents you from saying that it's adjacent to anything else that you might want to assert that it's adjacent to. You could also say it is adjacent to a maximum of 0 sidewalks, but that is introducing a cardinality restriction that if you were to use that with other object properties that have that are declared to be transitive or symmetric, might create problems for your reasoner. Your reasoner will probably crash and throw a bug, just because of certain global restrictions that OWL2DL places on the use of those types of declarations in object property assertions. It's a very technical and complicated thing, but the gist is that adding cardinality restrictions to things or negations in assertions can lead to issues with reasoning. And so I'm trying to avoid that here. You had a question?
My question was essentially, so the Winn-Dixie grocery store and Porter's community, have you come up with any method to essentially connect them? There's an unbroken sidewalk all the way between that community and the Winn-Dixie store. Therefore, you know you have that continuity. Have you come up with any way of measuring that? We have a similar problem set with where we're at, and that's what we're trying to solve.
So actually, no, I have not come up with any way yet to try to figure that out. That's a good question though. It's something that I've thought about, and I just recently have not had the time to do a full deep dive of how to figure that out. But that is a really good point and good question. All right, so moving on. So let's say you do, have in your ontology these assertions, and you create these individuals, and you map out these relations between them. One idea that I had for what you can do with this ontology to identify people who have access to this stuff or don't have access is through the use of what are called computable knowledge representations. An example of these being computable phenotypes, which have been used extensively in the past to identify certain patient populations based on eligibility criteria. Computable phenotypes are usually used for basically identifying people for studies or possible candidates for study subjects. And so an example of a computable phenotype is here. So it basically it follows an ontology subject predicate object triple pattern. And it'll use usually a set of these patterns to identify a patient who meets a specific set of criteria. And so here you have one of these little tuples, and it's basically saying what it says is subject diagnosed with Parkinson's disease. So this would be used maybe in an electronic health record database to identify patients who have been diagnosed with Parkinson's disease. These patterns can be stored in graph databases or triple stores. Just as an aside. And so here's an example of how you might use this to identify somebody who has access to the Winn-Dixie grocery store via a sidewalk. So you would basically take the ontology representation that I had in 2 slides back and transform it into this set of tuples. So you would have human member of Porter's community in that first tuple, second tuple, Porter's community located in geographical region of southeastern Gainesville, geographical region of southeastern Gainesville, location of Winn-Dixie grocery store adjacent to sidewalk. So this would identify somebody who has access to this. If you wanted, so this is where it gets complicated, partly because of the open world hypothesis, is how do you identify somebody who does not have access to that? One idea possibly is just to take the difference of patients who meet this criteria from the total population and look at those who are left over. But again, because of the open world hypothesis with OWL ontologies, the absence of an assertion does not necessarily imply, for example, the absence of an assertion about a grocery store's accessibility does not necessarily imply that the store lacks features that provide accessibility. And then of course, there's always potential issues with scalability when you're dealing with these, multiple sets of tuples and trying to query databases and build databases that are populated by them. So this is something I'm still working on. I'm not sure if you could actually, using these computable knowledge representations, if you could represent negations or negated relations. So 2 minutes? Okay. So let me go real quick here. I'm going to skip over this one, the ability to purchase food, because it's not that much different. And we're going to go directly into housing and ownership. So the other question or the other topic I wanted to get into is ownership. So it's really actually beneficial for Matthias to present before me on DX, because I'm going to be talking a little bit about DX. So in DX, for every obligation, there is an associated duty holder role and claimant role. although at the moment there is no class yet for obligation. In OMERS, we've proposed representing debt obligations as directive information entities. If you want to know more about that, I'll be talking about it on Wednesday at my talk at 2:35, which is the last talk of the day,
That's correct.
which is a talk on money. Right. And then additionally, when it comes to ownership, if you're talking about claims and obligations, it isn't clear who would be the bearer of a duty holder role in such cases. So if you're talking about home ownership, for example, you have a claim on that land or that house, but who the duty holder is kind of, at least to me, is a little complicated. It could be the regional government, it could be the community that lives there and their duty to, respect the fact that that's your private property and not trespass or vandalize it. And then there's also, for material entities, we do not have a concise way to relate the bearer of the claimant role to the entity they own. For most of you, if you're working with biomedical applications, you probably don't care about claimant roles unless those roles are directly applicable to your use case. For example, if you're studying the impact of one's environment on their health, you might just be interested in whether or not they own a house or live in a house. And so OBIB actually has a owns relation and as well as an is owned by relation that can be used for this. And so this is one of the ways that I'm kind of trying to explore how to represent ownership and connect the two to each other to have kind of a shorthand way of expressing that a person owns something without having to talk about all these roles.
One
So,
question,
thank you.
and then we'll go to break. We're past 3:00. We'll have a 15-minute break, so Matthias.
More of a comments on, I think that the representation is so all good. And maybe this is just in the talk. I think I have the impression you might want to do too much with the ontology. I actually think that this idea of having these access types like phenotypes is good. I don't think that that can be done completely in ontology because, I mean, you gave the example yourself of the ramp that is too long. So at some point you will need to do a lot of mathematics to calculate who has access and who hasn't, right?
That's fair. Yeah,
And then you're out of what you can do with reason.
that's fair.
So I think it's really the work, don't get me wrong, I'm excited, this is super important because you provide the machinery to represent all the data and maybe do some categorizations with reasoning, but ultimately building those phenotype-like situations, you will need to use mathematics itself.
Yeah, so in one of my previous examples that there was actually the one I wasn't able to get to with food access, they have there was one of the studies I mentioned earlier that looked at food deserts. They actually categorized grocery stores based on their cost of food as being high cost, medium cost, low cost. And so they have categorical variables or values that they use for that. So like one way to possibly do that would to just say that there's a food cost data item that has actually been validated by a study, and they've determined that that grocery store has, on average, very high cost food. Similarly for ramps, you could, if somebody actually sits there and verifies that and then publishes that data online, you might be able to make use of that for this. Unfortunately, that means extending the ontology further and making it a little bit larger. Which is one downside to that, but and then of course it starts to shy away from actually representing the reality, and you're basically just representing information in your ontology. So there could be some downsides to that too. So, but yeah, thank you for that comment.